Hey everybody, it's Dr. David with another Ask Dr. David video. Today I'm going to be talking about my take on the toddler versions of the COVID-19 vaccines. As you have probably heard, that there has been authorization for it to be used in children 6 months of and above now. And I have been already interviewed 5 times between newspapers and televisions about this particular topic, as well as my disagreement with Governor Desantis, who had said that there was zero risk to these young children relative to COVID. And of course, while rare, toddlers have died. Toddlers have been hospitalized, and to say that this is a zero risk is just a complete fabrication of the truth. It's rare that children, these young children will have problems, but it's not zero. Okay, now, of course, as with every intervention, I believe that one should properly and fully make lists for the potential benefits versus the potential risks of doing that intervention. Okay. But I also feel that the desire of the patient, or in the case of a child, the parent, of course, should be listened to. Very important to listen to the patients. People should have autonomy and rights over their own bodies and their families. Okay, so today I'm going to be talking about both the Pfizer and the Moderna toddler vaccine and the differences between them. I'm going to talk about the efficacy data in terms of like how well does it work. I'm going to be talking about the safety data that has come out, and then I will give my overall take. Okay, so first of all, as I had alluded to, we do know that the risk of hospitalization, death, or something serious to a child under the age of 5 is rather rare. Um, in all honesty, with my knowledge about how to fight off viruses and to deal with inflammation, would I be overly concerned if my theoretical 6 month to 5 year old child were to contract COVID and I knew what to do and had all my materials available to me? No, honestly, I really wouldn't, but I totally understand how in other circumstances that could be different. And of course, I completely respect the rights of families who do feel that it is in their child's best interest to give the vaccine, and I would completely support their decision to do so. Okay. Now, first of all, as you may know, this is the first time that a childhood vaccine has been available for Moderna. Prior to this, the younger children were only authorized to get the Pfizer vaccine. Okay. And there was a couple really interesting difference about this. So when it came to the Pfizer vaccine, the dose that was given for these young children was 3 micrograms, whereas it was 30 for adults and 10 for the younger children. So it was a much smaller dose, which of course that's nice with a lot of vaccines. They don't change the dose around relative to the age. The same thing would be true for a 7-year-old versus a 2-month-old for the DTP pertussis shot, for example. But I do appreciate that they do try to moderate the dose here to decrease side effects, make sure it works. But with the Pfizer vaccine, the 2 doses did not work. It required a third dose to be given. So basically, what they did for the Pfizer is they did 3 weeks between dose 1 and dose 2, found that it didn't work, but they did find that if given a third dose 2 months after that, then it did seem to work. However, with the Moderna vaccine, 2 doses were given. Now, the original dose in terms of micrograms was 100, and this has been reduced to 25 micrograms. So again, a lower of the dose, but they did find the efficacy was there for 2 doses. Now, of course, who in their right mind would give their child 3 doses when 2 can work just as well? And it would take an additional 2 months for the protection to be there with the 3 doses. So as far as I'm concerned, I'm not going to be talking about the Pfizer vaccine for toddlers anymore. We are going to restrict this conversation to Moderna. Okay. Now, um, the efficacy data itself. Okay, and let's just say it's not been overwhelming. Okay, they showed that for children in the 6-month-old to 2-year-old range, there was a 50% reduction in symptomatic COVID. There could still be kids who were asymptomatic, which of course that's a good thing, whether it's from a vaccine or just because there are some people who have no symptoms anyway, but a 50% in reduction of those types of any symptoms. Okay. In children, the ages of 2 years to 6 months, it was actually about 37% in terms of no symptoms whatsoever. Overall, in this entire up to 6-year study, they looked at about 5,000 children. So there were approximately 1,000 children per year of age in this study. Okay. So also, there really was not enough information. There was not enough study done, enough subjects used to know whether the vaccine actually reduces hospitalization or death, which of course that is supposed to be the main criteria. And certainly if we go back to Operation Warp Speed originally, that was the main criteria. Was there going to be a 50% reduction? Now, if they're saying that it's a 36% reduction, and not even knowing whether this does have any significant protection against hospitalization or death, it does seem to me as if the bar has been lowered as to what would receive an emergency authorization. Now, it does not mean that once there have been hundreds of thousands or millions of young children given the Moderna vaccine, that the research may show that there is a reduction in hospitalization or death. But just as we stand right now, when people are trying to make the decision for their families, there is not the evidence that supports that. Okay, doesn't mean that it doesn't exist. It just means that there's not evidence to support it. Okay, now safety. Okay, now quite possibly in part because they are using significantly lower doses, but there were no safety flags in the studies of these several thousand kids, and it's certainly really not much of a difference compared to the 5 to 11-year-olds. So, okay, that's good to know. It is also important to remember that the myocarditis, the blood clots, that was really never an issue with the younger children or even the middle-aged children. We predominantly saw the issue with the blood clots, the myocarditis, with with male adolescents and young adults. So again, nothing came out from there, but we also haven't really seen that in the larger studies that have since come out in the 5 to 11-year-olds. So that gives me at least some optimism that those may not be as big of an issue for the youngest of children. Okay. Now, let's talk a little bit about access. Now, this is relative to what's happening in Florida also, because we know that that the state of Florida has decided not to purchase COVID vaccines. They didn't pre-order it, but they've now said that they're not going to order it at all. They're not going to have it in any health departments. Now, this is a challenge because at some places like children's hospitals, they get it from the state source, it's not from federal sources. So it does seem as if some children's hospitals may not be able to access this at all or for a while. Now, furthermore, Walmart and Walgreens have said that they are only going to be vaccinating children up to after 3 years of age, at least at the time of this recording. And CVS is not going to be offering it for children under 18 months of age. So it does seem that there will be a significant supply issue when it comes to the youngest of children. Now, pediatricians' offices should be able to get it and should be able to get it soon. Those who participate in the Florida Shots program, my understanding is, will be able to get it. Now, we never chose to carry the Pfizer vaccine in our office. Again, Moderna wasn't available because if you remember, it needed to be done in a very, very cold storage, deep freezer situation, which we, as well as many other small practices, don't have. But also, you had to buy it in these very large dose number of units, and we would never go through that type of volume here in our office, and it would have been very wasteful as well. So we would send patients who wanted it over to the pharmacies. But again, what's going to happen now if that's there? But if the Moderna vaccine is available to us, and it looks like it's going to be available in a supply where that's not wasteful, would we carry it if people want it? Sure, we would. Also your health, your choice. If a family says that they want to get it and they feel more comfortable with us giving to them, and we can get it, we'd give it. I have no problem with that. Okay, so now what is my take on the whole thing? Now, first of all, if a child has already had COVID-19, like we've talked about, they almost certainly have more immunity than someone who does not. And of course, that does change around the calculus as to how beneficial a vaccine would give, because if a person has immunity already, they're going to have some level of protection that a person who has no immunity does. That is just immunology 101 basic sciences. Okay. Also, let's face it, if a person did have a disease once already and they did quite fine with it, the likelihood that they would catch COVID a second time and do worse with it would be really, really unlikely as well. So that's something to take into consideration for that risk versus benefit question. Now, as I said, there's no strong evidence that the vaccine does protect against hospitalization or death, but still, I don't think that the jury is out on that one yet because of the lack of numbers that have been done so far. Now, as I said, I do believe that the side effect profile will probably stay similar to what it was for the 5 to 11-year-olds because of what we've seen so far, plus the lower of the doses. Now, if a family wants to reduce their chances of their child getting an upper respiratory infection or potentially something worse with COVID, then there is a 35 to 50% chance, depending on whether they are in the older, above 2 year old or the under 2 year old group. Um, and of course, if there is concern about passing the virus to a high risk individual, or the child is at high risk themselves, then it is clear to me that there probably is some benefit overall to be going up, and the benefit for the vaccine and those individuals would go up. So, anyways, all of I have put links down in the section below where you can see what our sources are, and of course, please share this with as many people as you can, and join us on our social media and hit the notification buttons and all of that stuff if you want to stay up with what we're doing. So, hope everybody has a great day and a good day, and I hope this provides more information for you. Bye bye.